if we talk about the attachments of the ileum, we visualize the iliac crest. The iliac crest, we said, in its anterior 2/3, the concave inwards part has an outer lip, an inner lip, and an intermediate area. The outer lip of the iliac crest in its entirety gets the attachment of fascia lata. It is the fascia of the leg. Then inwards to the tubercle is the attachment of the tensor fascia lata, the muscle. In anterior 2/3 gets the origin of insertion of external oblique muscle. Behind the highest point in the posterior 1/3 is the attachment of latissimus dorsi. The inner lip of the iliac crest in its entirety gets the attachment of the anterior 2/3 gets the attachment of transversus abdominis. The fascia of transversus abdominis and the fascia iliaca are present deep to this muscle. Then in the posterior 1/3 is the attachment of quadratus lumborum, and it is bound by the thoracolumbar fascia. The intermediate area gets the origin of internal oblique muscle. So the anterior 2/3 has the attachment of external oblique on the outer lip, internal oblique in the middle part or the intermediate area, and inner lip has the attachment of transversus abdominis. If we talk about the posterior area, it had two slopes, the lateral slope and the medial slope. The lateral slope gets the attachment of gluteus maximus muscle. The medial slope gives origin to erector spinae. The deep to the medial margin is the attachment of interosseous and the dorsal sacroiliac ligaments. Then, if we talk about the anterior superior iliac spine, it gets the attachment of lateral part of the inguinal ligament and the origin of sartorius muscle. The anterior inferior iliac spine in its upper half gets the origin of rectus femoris, and its lower half gets the attachment of iliofemoral ligament. The posterior border of the iliac spine gets the attachment of sacrotuberous ligament above the greater sciatic notch and piriformis in the upper part of the greater sciatic notch. For the surfaces, the iliac surface or the iliac fossa in its anterior 2/3 get the attachment of a muscle which is called iliacus in its upper 2/3. The lower part, this part, has a bursa which is called the iliac bursa. In the posterior part or the sacropelvic surface, the iliac tuberosity gets the attachment of interosseous sacroiliac ligament. In this prominent part gets the attachment of interosseous sacroiliac ligament. The dorsal sacroiliac ligament is present posteriorly, and the iliolumbar ligament is present superiorly. The convex margin of the auricular surface gives attachment to the ventral sacroiliac ligament. This pelvic surface gets the attachment of the lower part of the ventral sacroiliac ligament and the origin to the fibers of piriformis and obturator internus. If we talk about the gluteal surface, it was divided by 3 lines into 4 parts. Just behind the posterior gluteal line, this part which is present between the posterior superior iliac spine and the posterior gluteal line, it gets the attachment of gluteus maximus, which was coming from this slope. Then the gluteus medius is attached between the posterior gluteal line and the anterior gluteal line. This is the attachment of gluteus medius. Between the anterior and the inferior gluteal line is this large attachment of gluteus minimus, and below the inferior gluteal line is the attachment of some fibers of rectus femoris muscle. Now let us talk about the pubis. This pubis is the antero-inferior part of the hip bone and 1/5 of the acetabulum. The pubis has a body, this part. It has a superior ramus and an inferior ramus. If we talk about the body, This is the part that is flattened from anteroposterior direction. It is flattened anteroposteriorly and it has a superior border. This rounded border, which is called the pubic crest. It has a pubic tubercle on its lateral side. This one is the pubic tubercle anterolaterally, and it has 3 surfaces. This anterior surface, this medial surface, and a posterior surface. If we look at the pubic crest, this is a ridge that extends from the medial surface, upper margin of the medial surface, towards the pubic tubercle. The pubic tubercle is the extended part or the prominent part at the lateral end of the pubic crest, this part. The anterior surface is directed downwards. If we see here, it is directed downwards and laterally, slightly forwards. In its supromedial part, it is rough and it is smooth elsewhere. The medial surface articulates with the medial surface on the other hip, and the posterior surface, which is also called the pelvic surface, it is smooth, directed upwards and backwards, and it forms the anterior wall of the true pelvis and is related with the urinary bladder. The bladder is present on this surface. The superior ramus extends from the body of the pubis towards the acetabulum. It has 3 borders and 3 surfaces: the superior border, the anterior border, and the inferior border. This border is the inferior border. The superior border is also called the pectineal line or pecten pubis. It is a sharp crest. Look, it is very sharp. It is a sharp crest that extends from behind the pubic tubercle, goes towards the iliopubic eminence. This with the pubic crest, the pecten pubis with the pubic crest, forms the pubic part of the arcuate line. The anterior border is also called the obturator border. It extends from the pubic tubercle towards the acetabular notch. This notch is called acetabular notch. It extends from the pubic tubercle towards the acetabular notch. The inferior border is sharp and it forms the upper margin of the obturator foramen. Between the superior and the anterior borders is the pectineal surface. This surface is called the pectineal surface, which is a triangular surface. Here is a triangle, and it extends from the pubic tubercle towards the iliopubic eminence. The pelvic surface is present between the superior and the inferior border. It is smooth and is continuous with the pelvic surface of the body of the pubis. The obturator surface is a very thin surface which is present between the anterior and the inferior borders. It is marked by the obturator groove. Inferior to the body of the pubis is the inferior ramus of the pubis. This inferior ramus is joined by the superior ramus of the ischium, so it forms a conjoined ischiopubic ramus. We will discuss it in a minute. If we talk about the attachments of the pubis, we have the pubic tubercle. This pubic tubercle gets the attachment of medial end of the inguinal ligament. It is present here from the anterior superior iliac spine towards the pubic tubercle. It also has the attachment of cremasteric muscle in males. Then, if we talk about the pubic crest, in the medial part, it is crossed by the medial head of rectus abdominis, and in its lateral part, it has the origin of the lateral head of rectus abdominis and pyramidalis muscle. In the anterior surface of the pubic of the body of the pubis, on its margin has the attachment of anterior pubic ligament, most medially. At the angle of the pubic crest and the symphysis pubis is the attachment of adductor longus. Then medially is the attachment of gracilis. If we move laterally is the attachment of adductor brevis, and lateral to it on the margin of obturator foramen is the attachment of obturator externus muscle. In the posterior surface, in the middle is the attachment of levator ani. Lateral to the levator ani is the attachment of obturator internus muscle. If we talk about the pectinate line, medial side has the attachment of conjoint tendon. Anterior to the conjoint tendon is the attachment of lacunar ligament, and then the whole length of the pectinate line has the attachment of pectinate ligament. The pectineus muscle also arises from whole length of this line. The upper part of the pectineal surface gives origin to pectineus muscle. Then the obturator groove. Here it provides the transmission of obturator vessels and nerves. The pelvic surface of the ramus of the pubis is crossed by ductus deferens in males and the round ligaments in females.